I'm joined by Western Cape Health Department Head Keith Cloete. Keith Cloete, thank you very much for your time here on South Africa tonight. Now, are you worried as a health department seeing these numbers go up every day now in the Western Cape?
Good evening, Masejo, and good evening to the viewers. We have seen an increase in cases, and we still see an increase, but the rate of increase is slowing down. So although you've recorded just over 4,000 cases, it was predicted that we will have about 4,000 cases for the 7-day average period. And the prediction for next week from the South African COVID Modeling Consortium is that this will stabilize. And over the next 10 days, we will start seeing a decrease in the Western Cape. So we are still concerned because the cases have not quite peaked yet and not come down yet. The phenomenon that we've seen, though, which is the same as in Gauteng, is that the rate of hospitalizations have been considerably slower than in previous waves. And also, the percentage of people requiring oxygen, having severe infection, requiring oxygen, being on ventilators is much lower. And therefore, also, our death rate has not actually increased in the fourth wave yet. So we are concerned about the rising cases, and we obviously want to make sure that we contain cases at all costs. But the impact on the healthcare system has been significantly less than in previous waves, as witnessed in Gauteng and in other provinces.
Mr. Cloete, talk to me about vaccinations in the Western Cape. How are you doing in that front? What's your target, and how far are you from reaching it?
Our target for people over the age of 50 has always been a very steep target to reach 85% of people over the age of 50. We are in the high 60s. We're the highest, about 66 fully vaccinated in this province. It's the highest for the country. Over the age of 60, we have quite high figures, closing in on 70%. There's even some areas like the Overberg where 91% of people over the age of 60 is fully vaccinated. So we've not quite reached the target of 85%, but we have achieved the best for the country so far. And we continue to encourage people to come for their first vaccinations, especially now that the booster doses are also going to be implemented. So our efforts remain to protect the most vulnerable. And we are looking forward at ways of constantly taking vaccines out to people through vaccine taxis, to all kinds of outreaches, and we're encouraging people to come forward to be vaccinated.
So you shut down your CTICC vaccination site. Do you still believe that was a good idea? Absolutely the right idea.
The whole idea of CTICC was always to keep it open during the first phase of vaccination, especially as we were ramping up quite steeply for the younger age groups. It has served its purpose. It has come to an end. We also did it at the time while we were still scaling up our capacity across other sites, especially in private sector sites. Currently, we have sufficient private sector sites open and public sector sites across the province in close proximity to where people live. And the mass site like CTICC at this point in time is not an indicated site for what we intend to do for the vaccinations, especially for the booster doses over the coming months.
And the trend that you're seeing in your hospitals, Mr. Cloete, with the amount of people who are at hospitals, is it the same as here in Gauteng, where those who are not vaccinated are the ones that you're finding at your hospitals?
Yeah, by most accounts, most of the people that are being admitted is firstly the following. It happens to be in a slightly younger age group. So we have a heat map that we check our our hospitalizations per week. And the younger age groups, it's about 35 to about 45. That's the age group where we see the most admissions. That happens to be the age group where our vaccine coverage is the lowest. And so we are also seeing of the people admitted in hospital, the majority of them are unvaccinated. We are using our data to verify that specifically, and of next week we will be doing that regularly to update people exactly what the vaccination status is of people that's hospitalized in our system.
All right, Mr. Cloete, well, we saw that the Cape Town International Airport says that it's seeing almost 2,000, people coming to the Western Cape. That's quite a lot. And, of course, we're grateful about the tourism coming into our country and the lifting of the bans, etc. But that also means that people should be more careful now because, the COVID-19 pandemic is still among us.
Yes, so we are basically following the science. And the science tells us that there's a few things that you should do that breaks the transmission for COVID. So the first thing is we encourage everybody to be vaccinated. So we know that the tourists that are coming in are all vaccinated. The second thing is we encourage people to wear masks, especially when they're going to go indoors. And we encourage ventilation for indoors and not crowding in indoors. And then the big thing is we're encouraging people, the weather is beautiful in Cape Town this time of year, it's encouraging people to be outdoors. So over Christmas, our message is keep it small, have an intimate bubble, know the people that you are, sit outdoors, socialize safely. And we know that if we have those observed in many places, we can curb further transmission of the cases.